Thank you, everybody. It's my pleasure to present this on behalf of my colleagues Yolandi Cox, Dr. Craig Getty and Catherine Johnson. We know that cancer diagnosis and treatment is complex, and we know that cancer patients report that their greatest unmet needs relate to information and that accessing this information is difficult. The Hunter New England Area Health Service is geographically vast and provides services to almost 1 million residents. Many patients who come from rural and remote areas are further disadvantaged when it comes to accessing information. My hospital, the Calvary Mater Newcastle, is the primary referral centre for oncology, and many patients travel to receive services there. It was for this reason that the idea for a service-specific app, CANcierge, was born. The CANcierge app is designed to run on smartphones and mobile devices, and as you may have seen from the title page, and I'll just quickly go back there, it's easily identifiable by the large C. We are aiming for this app to supplement existing services by providing easily accessible and relevant information and frequently asked questions. It was very easy when we started this project for us to think that we knew what was important for patients and what would go in this app. However, we risked getting this very wrong, and the need for consumer engagement became paramount. As we received money for this project from the Mater Auxiliary, and essentially this project is funded by $1 lolly bags, it's equally important that we got this right first go. We set about to partner and consult with our consumers, our patients, meeting Standard 2 to help improve the overall quality of the existing healthcare system. We achieved this by undertaking consultation with a facilitated focus group and via an electronic survey. Prior to commencing this project, we sought ethics approval, and this approval allowed us to send electronic survey out to patients and their carers, either in the ambulatory care centre or at home. This survey was distributed in December 2016, and the facilitated focus group was commenced in March of 2017. This survey included patient demographics, smartphone use, their computer use, their internet use, health app use. It was also allowed for patients to score how useful they thought certain information would be to include in a smartphone application. We received 39 surveys from participants, and of the 39 surveys that we received, 56% were female. The age range was between 18 and 90 years, with the average being 62 years. 5% were Aboriginal or Torres Strait Islanders. All were English speaking, and this kind of reflects where we actually live. 9 participants identified as carers. 61.5% currently received cancer treatment, and 48% had prior experience with health-related apps. And of those 48%, 43% had sought information about their cancer and treatment from the internet. This was the list that we developed to distribute as part of the survey. So we kind of put together things that we thought would be important. We sent that out and asked the patients to mark what they thought was most important and what they thought was least important. And the themes contained within these questions, they were the ones that helped guide our focus group. And the focus group consisted, although it was small, we sent out invitations to 10 participants. On the day, we had 6 patients and 1 carer. Within the focus group, they identified those which are highlighted as red as their priorities. So they were a little bit different to those that were contained in the survey. Some of the things that the focus group identified that we hadn't identified in that slide were things like relaxation, meditation, a suggestion box, a must-have for all cancers or cancer-specific fact sheets, appointment feedback, a list of medications, side effects, allergies, a digital version of the chemo card, so the one that is presented to emergency, and links for support services for children. The consumer engagement of part of this development process has greatly helped us focus and prioritise the content. Before completion of the design of the app user interface, screenshots were emailed to the focus group for comment. The interface was also presented to the local Indigenous community or aunties for comment. Overall, the focus group participants believed that the app would be a useful tool for patients undergoing treatment and its design appeared user-friendly. The inclusion of an Aboriginal and Torres Strait Islander section was also welcomed by the local Indigenous community. We're currently in the build process of this app and we have more than 170 pages of content to load into this app, and we've also sought permission to point out to relevant non-government organisations so we're not replicating existing information, and this was one of the most important things of this project, that we weren't rehashing what was already done. The development of this app is such that it may be able to be picked up by other area health services who can introduce their own content. For us, the aim is to make this a comprehensive, one-stop shop for our patients. We have a launch date set for November this year, and at that time we hope that it will be available in Android and the Apple shop. So we really look forward to perhaps showing you a bit more of this app at a future date. Thank you.
Great, thanks, Julian. Do you just want to stay there? We've got time for a couple of questions. Down the back, Shital.
Thank you. My name is Shital, and I work as a multicultural community liaison at the CANcierge New South Wales. So, Gillian, did your app capture any multicultural demographics of your patients at all, considering how culturally diverse Newcastle is getting, or the area around Newcastle?
Yeah, so actually, no, it didn't. We did have, we showed the content of the app to our multicultural health committee at the hospital. But the actual surveys and the focus group, there were no respondents from any other multicultural and culturally diverse groups. Is that what you were?
Yes, like did it? So I assume it didn't capture country of birth or language other than English spoken at home? So
no. So within the app, there will be some demographics that we will capture. So that was. The presentation was purely around the development of the actual app. So we're in the process of deciding what we can collect. And so that may be something we collect. But in terms of other interpreter services, other services for the culturally and linguistically diverse community, there will be those things will be included within the body of the app.
Hi, my name is Monique. I'm from the Agency for Clinical Innovation BMT network. Just with the regard to information that you're providing on treatments and stuff, is there going to be anything about BMT in the app?
Yes. Essentially, we're trying to point out to all the... we don't want to recreate anything, so there'll be information pointed out to the Cancer Institute, to the Cancer Council. So there will be information about different treatment modalities and also bone marrow. But I guess this is phase one of our app. We are hoping then that we kind of can get some more funding, and then we can go forward from there and actually, make it a bit more specific.
Thank you.
Okay, time for one more question. I think there's one down the middle here. There we go. And then we'll move on.
I just wanted to ask, for those that aren't IT clever, what was your consultation for the implementation of the app? So who was consulting you about the costs for the app, or how the app gets started, or the IT world about apps?
As you can see, we are 3 nurses and 1 doctor We interviewed several app developers prior to the process. We had to get something that was financially viable. We hired a company that has done previous health apps, so that kind of helped us, decide who we would go with. It's a very difficult process. It's something that I've never had anything to do with, and it's quite scary, and it's a lot more involved than probably I'd thought that it was going to be.
Yeah, that's what I thought. So that's why it's good to know what you did.
Yeah.
Yeah. Thank you.
Great. Thank you. Thanks
Thank
very
you.
much, Julian.